our network. So we launched yesterday, last year. So, but we launched it virtually, and since the launch, we have had several virtual meetings, and they but haven't got a chance to have a hybrid or face-to-face meeting. So now today I'm very pleased to see you everyone here with the first face-to-face event and hybrid event for our network. And I'm glad to see everyone today, including some of the management team and advisory board. We first met, although we work so closely virtually for the network, but the first time we meet each other in person. So I thank you for being here and for participating and for sharing your expertise on our topic. And we have gathered a quite impressive lineup of speakers and also panelists, and who will address a range of the timely and important topics on the future blood testing. And to open this workshop, so I'm gonna give a brief tour and of overview of our network, and also followed by the arrangement of the 2 days workshop. So I will give a quick overview of our future blood testing network plus. So you might have seen these slides already if you attended our previous virtual event, but for those who are new, so you can come and meet our core management team. So I'm a director, and we also have co-directors and Rob, and Mark will come in tomorrow, Jeremy coming later today, and Serhi as well as a management team and co-directors, and we have lovely coordinators. Sammy here will take care of everything, logistic, and also the rest of the event, and also deal with the network. So where we come up this idea about the future blood testing is that so let me try to turn this off. Do you know how to turn close this one? Yeah. Fantastic, thank you. So we come up with the idea about the challenges of about blood testing, because blood testing is the most important and common type of medical test. So you need to do blood tests for most of the diseases. You want to diagnosis, early detection, and also if you want to have a drug monitoring or treatment monitoring, you need to have a blood is one of the key tests to measure the health. And also, as you can see, that almost 95% of the clinical pathway, depending on test result, and also depending on the efficient test result, accurate, efficient. But the problem is that, so for Muslim community, and also highlighted by COVID-19, so there are quite a lot of inefficient. Patient has to go to the GP surgery, or has to go to the hospital to get blood testing done, and especially we all see the pandemic that really brings a lot of the inefficiency, because you have to go to the hospital, and bring a lot of burdens for the patients and also health professionals to make timely decisions. And so that's why we are thinking, so what if we have some new solutions that patients, also doctors, will be able to carry out their own tests remotely or near patient tests, so they will be able to speed up the decision makings. And also with the data available, we'll be able to give them more personalized analytics. So that's the idea. We gather quite a lot of the different expertise and also industries and also the NHS trust. So we are hoping to build the community, multidisciplinary community, to develop technology for the more remote, rapid, and affordable and inclusive means we can test different type of the biomarkers and personalized analytics. So really we want to bring not only academics, but also the patients, as well as the clinicians, as well as the industries, to see what is the best way to make a good impact of our research. And the idea, so to conceptualize our idea, future blood testing idea, so you can see there's a closed loop here. So, and we're really looking at the patient. If you look at the top, on the top, the patient at home, especially for a patient, it's a non-clinical settings. So we're not talking about patient inpatient or patient in ICU. So we're really talking about the patient who is in the non-at-home or near-at-home or non-clinical settings. How could they get their blood testing monitoring done more efficiently? And then that bring up our three key technical challenges, which is in red of this circle. So the first one is a remote blood monitoring. So that's more about device sensing, sampling, non-invasive technology that can get a blood sample and to be able to get information of the blood analysis at near patient, remotely or near patient at a non-clinical setting. And then ICT is another second technical challenge of our network. So what is better to build ICT infrastructure, cloud system, and ICT security to bring this data, connect these devices towards the hospital systems and electronic health records and data connectivity. And then how can we use this data, that longitudinal monitoring, for the personalized analytics AI to provide decision support. So those three areas in these red colors boxes are those three key technical areas. And then, so we are going to really focus on the co-creating with clinicians and patients together. So not only building the technology, but really we see what do patients really need, what does the clinician really need in the practice, how does it really can help personalized medicine for clinicians and even for the treatment as well. So we really hope to keep a close look, as close as possible, in using the data, technology, and an efficient way that will come up with the new digital systems to support real-time or near real-time blood monitoring, self-management, or time intervention and the healthcare. I'm not repeating too much on these three technical areas, but you can be able to have a look at the three technical areas: the sensing, imaging, a portable device, ICT, and AI. And quite a lot of people ask me about AI in the network. So I just want to highlight. So the AI we are talking about here is we have different levels. The first level we're looking at is AI for the blood sample analysis. So you might have different blood sample, and you might have signals from sensors that you detect your blood information. So how could we use AI to analyze the blood sample? So to analyze like digital pathology, how could we use AI to accelerate, automate that? And another level will be the diagnosis. How could we use the most of data, the longitudinal data to support early detection and the diagnosis? And the third level we're looking at is how can we combine the blood testing data with all the other multi-source healthcare data together to support the personalized decision support for self-management as well as for the clinicians' clinical decision making. And we really encourage the clinical applications to encourage people to sync their technologies into the application, either the early detection, diagnosis, or drug treatment monitoring, or even just the automating or non-automated decision supporting primary and secondary care to improve efficiency. So that is the key clinical areas. But we are talking about future blood testing, but to be honest, this idea and also this system has already been happening in some of the disease areas. For example, infectious disease. So we're so familiar with infectious disease over the 3 years COVID that make us so familiar with everything, about testing everything. So, but not only COVID, before COVID, HIV as well. So there are some connected mobile diagnostic system around in the world. So to give feel like prototype of the future of the blood testing. So for example, so for this one, so now we have with a mobile phone and also with sensing technology, we will be able to detect either physical symptoms or disease biomarkers, either through the built-in sensor on the phone or external sensors, where the data can be transmitted to the cloud things. And so that is already happening in the COVID and also others and also other infectious disease. And the key thing to have a connected healthcare using this data connected together. And another thing, non-infectious disease, another good example will be the type 1 diabetes disease glucose monitoring that have a non-invasive sensing that get the data automatically from the sensor, and then you will be able to have a personalized pattern analysis for the people. For example, TI time in range, that's a new metrics for people to manage their treatment. So that is what we want to do, and we have gathered and we've got a group of very good, impressive partners together. Some of you are sitting here together to see what if we can develop technology for other disease, for other biomarkers, not only glucose, but also some other biomarkers for other blood testing and for wider disease that can help more people. So we have bringing the international universities, 6 trusts, and also SMEs, and also we have 5 EPSRC network within our management team and also the advisory board. And our key objectives here, so I use a very conceptual diagram here. So through the meetings and our research, we would like to encourage everyone to identify the challenges. What are the great challenges for the future, the vision of our remote monitoring analytics? And with the identified challenge, we will be able to help you to develop some projects. So we are going to launch our collaborative innovation projects today, the funding. And the reason why we call collaborative innovation, because we really encourage people to cooperate with end users together from the beginning of your research. And then in the end of the network, so what we are hoping is that with the new ideas, that they're emerging and the consortium emerging, so we'll be able to have our ideas funded by larger fundings, applications, and then can really make our ideas into a life, bring our idea into a life after the network. So we have already done some activities since November, February, and June. We have, especially in June, we have a landscape report awarded to University of Warwick and the University Hospital Coventry Warwick Trust. So P.S. Dimitris and Neil. So Dimitris will introduce the landscape report later on. So this is the outline of day 1. So we'll start with some landscape reports and what challenges from clinical and also technical perspective. And then, so we will showcase some of the preliminary studies about the landscape analysis, AI research, and then Sammy will introduce the collaborative innovation project funding launch in the afternoon. And also I want to highlight the 1-minute pitch. We already have some people submit the pitch. So this is really to encourage people to introduce yourself. You can just tell give a 2 slides saying that who you are, what is your expertise, what collaboration are you looking for within this within our topic of a network. And then so we have afternoon session for pitch, or tomorrow we have another session. Just feel free to let us know. And day 2, so we have some more presentations and we'll have panel discussions. So to talk about some topical issues, also Sarah knows a lot of people mentioned that during our network. So a lot of important issues in our around this topic. So that is the arrangement for today. And before I hand over to the session chair role, so you spend 2 days here, you spend here today. So we also have a nice campus. In the break, you might want to go around, and so we have Whatnot Lakes and Harris Garden. So I hope you can enjoy your stay in University.